Hi, I'm Sharon Apperson. I'm a nurse practitioner. I work with Dr. Stout. I'm here today to talk about genicular artery embolization and how it can help with knee pain. So, genicular artery embolization is a way to help with pain from osteoarthritis. It targets that pain. And with osteoarthritis in the knee, it causes inflammation in the joint that leads to the body triggering a growth of new, small, spidery-like arteries that are abnormal. And what that does, it actually increases the inflammation in the knee, increases the nerves being inflamed, and increases your pain. What we're able to do is go in and find those under x-ray, then inject them with these microspheres or antibiotic crystals that cause those arteries to close off. Then over time, we have a decrease in pain and you have better mobility. So this is covered by insurance, but there are certain criteria that we have to meet in order to get them to cover this. One of those is we have to have documented on an imaging study, either x-ray or MRI, that you have osteoarthritis. 2, you have to have tried other therapies before we can do this. This is not considered a frontline treatment. And 3, that it is starting to impact your lifestyle, meaning it's keeping you from doing what you want or need to do. So with this procedure, there is an 80% chance of 80% reduction in pain. It doesn't mean there's 100% and there'll be no pain, but there's an 80% chance that this will reduce. There is a slight risk that it will not help your pain. And unfortunately, there's no test or way to predetermine who those patients are that this will not help. We do this procedure in the office. You'll be there that day of the procedure, about 4 hours. Procedure itself takes about an hour, give or take. We do give you a little bit of sedation, so you'll be relaxed. You might be a little sleepy. And then you'll have some recovery time, usually about an hour after the procedure before you can go home. So a lot of the patients use this to either avoid a knee replacement or to push it down the road and not have to do it right now. The nice thing about this procedure is it does not interfere with any other options that you have in the future to help with your knee pain, whether it's a knee replacement or new therapies that come out to treat knee pain. When you have your appointment, I'll be available to discuss any other questions, and we'll go into some more detail with you regarding the procedure itself. I hope this video helped you understand the procedure and what it can possibly do for you. Please feel free to do your own research before your appointment. Look at our website and page, the GAE page that we have there, and feel free to ask questions when you come in to see.